Americans overwhelmingly support Arizona's right to control illegal immigration, but the liberal media don't. They're pushing a left-wing agenda and calling it news. It's time the liberal media tell the truth. Go to tellthetruth2010.org and join the fight.
Todd Park, the Chief Technology Advisor at the U.S. Department of Health and Human Services, spoke to CNSNews.com here at the mHealth Summit about the National Electronic Health Records Database. Are you familiar with any efforts that HHS is taking part in to digitize existing medical records throughout the country?
So the whole electronic health record effort is being led by David Blumenthal. So he's the guy who's actually driving all that work, and so I'm helping him as an advisor. But he's really the guy who's working on the High-Tech Act and electronic health records in general.
What would you say is the state of that? Is it coming along as planned and on target?
It seems to be going really well. Yeah. So David's done a really wonderful job of really having an open conversation with stakeholders about how to actually make this electronic health record investment work. And one of the coolest things about it is that you're not reimbursing providers for just buying technology, right? You're actually paying providers incentive payments for the meaningful use of technology. Because just buying technology by itself isn't useful. It's really the meaningful use of technology that's what generates social benefit. So there's been a really terrific definition of meaningful use that's been created through a really open public process. There have been regional extension centers set up across the country to help providers, particularly small primary care providers and rural providers and folks who have less resources get help with how to meaningfully use health information technology. And a lot of progress that's been made in establishing standards that really facilitate health information exchange. And so I think so far so good. It's been a really terrific public-private effort.
And is there any, from a technology standpoint, anything that you may be able to talk about that's been put in place to put people concerned about privacy at ease with the electronic health records database?
Yeah, so there's been an extraordinary amount of effort as part of this whole process about put on privacy and security. And so standards for privacy and security of electronic health records, and patient privacy in general. And that's at the top of the list of what David's really been pushing as a national coordinator for health IT, and will continue to be, just a guiding star, a north star for all of the work that happens.
Are there anything as far as like password protection? How will this be implemented at the doctor's office, and how will information be put on there in a way that's private and secure? There are actually
a whole host of requirements along those lines that have been promulgated by the Office of the National Coordinator in the regulations that have been put out recently. So requirements for basically what, for example, an electronic health record has to do to be certified. And you actually have to use a certified electronic health record if you're a doctor or hospital and you want to get these meaningful use incentive payments. And so, David's assembled the best privacy security experts in the world to advise on this, because it's incredibly sensitive and important, and their wisdom has been dialed into the regs that have been promulgated.
Some members of Congress have said that people will be able to decide what information goes on the electronic health record from their existing paper records. In other words, they're going to have a choice. Like if they don't want something private, like an abortion or mental illness, put on the record, they can decide to opt out. That's why I mentioned passwords and how users will be able to get this information on to the electronic health records database. Do you know anything about whether people will have the choice to put what they want on the record?
Actually, I'm not familiar with the details of that particular aspect of the program. But in general, I know that the operative principle of all of this is patient choice. That it's your information, and you should be able to control what happens to it and where it goes. And so that very much is the guiding ethos of the requirements in general.
You mentioned open and transparency with what you're working on at HHS.
Yes.
And could you talk a little bit about what specific area that you're working on that has become an example of open and transparency?
Yeah. So we've been working very energetically to liberate HHS data. We are already seeing a lot of innovation happen around the data to turn into stuff that's really useful to patients and consumers and providers and local communities. So we've taken data on community smoking rates, obesity rates, availability of healthy food, et cetera, and made it easily accessible and findable online. Innovators have started to pick up that data and turn it into community health dashboards that make your local health performance transparent, that connect you to what other communities are doing to improve health performance. We've launched an initiative called Blue Button, which enables, as I spoke about in my speech, a veteran working with the Department of Veterans Affairs and Medicare beneficiaries to go online and download a copy of their own data so they can actually have a copy of their own data and understand it, upload to other applications of their choice. So this whole notion of taking HHS data and respecting privacy and confidentiality, making it more accessible to the American public is something that's already yielding a lot of benefits by helping to engender innovation on a broad scale to build stuff that's really useful to the American public.
Nicholas Balassi, CNSnews.com, Washington.